Many people with hyperthyroidism and Graves' disease prefer not to take antithyroid medication to manage the symptoms and would like to take a natural approach to healing their condition. Symptom management is very important with any hyperthyroid condition, and for those who don't want to take methimazole or PTU, there are natural alternatives. L-carnitine has been shown to inhibit thyroid activity when taken in large doses, and as a result, it is taken by some people with hyperthyroidism and Graves' disease to help manage the symptoms. So what is L-carnitine? It is a nitrogen-containing compound, and it helps with the process of transporting long-chain fatty acids into the mitochondria for oxidation. It is manufactured from lysine and methionine, which are amino acids. Even though L-carnitine is mainly found in the muscle, most of it is produced in the liver. The kidneys also manufacture some L-carnitine. Some food sources of L-carnitine include beef, pork, fish, chicken, and dairy products. As for what L-carnitine does, in large doses it inhibits thyroid activity, and there is some evidence that it also affects the conversion of T4 to T3. Alright, so the dosage of L-carnitine needed depends on a number of factors. First of all, if someone wants to continue taking antithyroid medication, then they will want to take a lower dosage than someone who decides not to take the drugs. The same concept applies to someone who incorporates other natural remedies to help manage their hyperthyroid symptoms. For example, if someone is taking bugleweed, which is an herb that inhibits thyroid hormone production, then they would take a lower dose of L-carnitine than someone who wasn't taking this herb. As for specific dosage information, some sources will recommend for people with hyperthyroidism and Graves' disease to take up to 4 grams of L-carnitine on a daily basis. But once again, the dosage will vary depending on whether the person is taking antithyroid medication and/or herbs. If a patient of mine is taking antithyroid medication or an antithyroid herb such as bugleweed, then I will recommend a smaller dose of L-carnitine to begin with. If someone is relying on L-carnitine alone to manage the hyperthyroid symptoms, then I will recommend a higher dosage of the supplement. If someone with hyperthyroidism or Graves' disease chooses not to take any medication, then I typically will recommend a combination of supplements and herbs to manage the symptoms. While I think L-carnitine is a great supplement, the primary natural remedy I recommend for symptom management is bugleweed. When I was initially diagnosed with Graves' disease, bugleweed was the main herb that helped to manage my hyperthyroid symptoms. To be honest, even though I currently recommend L-carnitine to some of my patients, I personally never took L-carnitine when I followed my natural treatment protocol, and the reason was because I wasn't aware of the benefits of L-carnitine at the time as it pertained to hyperthyroidism. But as I learned more about this supplement, I began recommending it to many of my patients, and it does seem to do a good job of managing the symptoms when taking in larger doses. Motherwort is another herb that can help with symptom management. This is similar to a natural beta blocker, as taking this herb can help greatly with the cardiac symptoms, such as a high pulse rate and palpitations. Although bugleweed helped my hyperthyroid symptoms greatly, I eventually took motherwort as well since I still had some heart palpitations. And some people also take lemon balm, which is another wonderful herb that can help with symptom management. All right, getting back to L-carnitine, in addition to regular L-carnitine, there are a couple of other forms. One form is propionyl L-carnitine, which is used to help with conditions such as peripheral vascular disease and congestive heart failure. Acetyl-L-Carnitine is typically used for other conditions, including mental disorders, nerve pain, and low testosterone. Some sources state that propionyl L-carnitine and acetyl-L-carnitine can be combined to help with chronic fatigue syndrome. With regards to hyperthyroidism and Graves' disease, I typically recommend regular L-carnitine, although some people seem to do better when taking a combination of the 3 forms I mentioned here. But the combination of bugleweed and L-carnitine seems to work well. Acetyl-carnitine will help with the production of glutathione, which is important for both immunity and detoxification, and this may explain why some people do better when combining the different forms of L-carnitine. Now, of course, keep in mind that L-carnitine isn't a cure for hyperthyroidism, as while taking it can help with the hyperthyroid symptoms, and over time may improve the thyroid hormone levels and TSH, it won't do anything for other compromised areas of the body. So just as is the case with bugleweed, L-carnitine is only one component of a natural treatment protocol, and taking it alone won't restore someone's health back to normal. So to summarize, L-carnitine can help to manage the symptoms of hyperthyroidism and Graves' disease. Some people with these conditions will take L-carnitine by itself with regards to symptom management, but I typically recommend a combination of bugleweed and L-carnitine to my patients, or many times just bugleweed alone. Either way, it's another option to consider for those with hyperthyroidism and Graves' disease who are following a natural treatment protocol. To receive more natural thyroid health tips, please visit naturalendocrinesolutions.com, where you can get a free guide entitled The 6 Steps on How to Treat Graves' Disease and Hashimoto's Thyroiditis Through Natural Methods. This guide contains 100% pure content and is not a sales pitch for any product or service. Thanks for watching this presentation.